We are so excited today because I have two amazing women of color with me who are doing amazing work in the medical field. And they're going to be talking to us about back to school, COVID-19 safety, amongst many other things. So, if you want to be well and healthy this year and you care about your families and your kids being healthy, then we admonish you to tune in and to stay until the end. They're going to be providing information about tips as well as why they got started in this field. Cassandra, Sophia, welcome. We are so excited to have you here with us today.
Thank
Thank
you.
you. Nice to be here.
Truly a pleasure.
Yes. Yeah. And I got to say, I don't remember both of you are from the Bronx, but shout out BX in the house.
Go Bronx, Bronx.
I love it. No, every time I meet people like you that are leaders in the community, making a positive difference and change, and from the Bronx and Black, it just makes me so excited. So we're gonna have so much fun today, and we're gonna educate and empower our community.
Absolutely.
Absolutely.
All right. So today we're actually doing a special segment. Typically, every Thursday, we run 30-minute fireside chats. Today, it's much longer because we want to really dig deeper into how do we keep families and kids safe during this season when flus are up, COVID-19 numbers are running up again. This is the season where people are traveling. And so we really want to make sure that we keep our families safe, our community safe, and even those that are in the business safe as well. And we have two experts with us today. So the first is Cassandra Boone, born at Union Hospital in the Bronx. Inside joke, we won't get into it. And entered the medical field as a medical assistant. She's worked in different specialties from primary care to gynecology, and now has found her home in urgent care. And then she also specializes in the clinical aspect to administration. So she's been doing great work again from the Bronx. And we have Sophia, born in Jamaica in the house. Um,
Woo-hoo.
let's go. Migrated to the Bronx when she was 15 years old. And she entered into the medical field first being a physician assistant. She's worked in a number of different specialties, has now found her home and love in emergency medicine and urgent care. And Sophia is known for treating her patients with compassion and being passionate in all aspects of patient care. This is incredible. You ladies are literally re-engineering urgent care practice, and this is going to be a great conversation. So again, thank you for being here, and again, welcome.
Thank
Thank
you.
you so much for having us.
Yeah, well, let's jump into it. First question is going to be going to Cassandra. However, Sophia, feel free to jump in to respond as well. So, communities and schools, I think, we over the last 3 4 years, going on 4 years with this COVID-19 pandemic, have been challenged with keeping kids safe and well. There's a lot of literature out there, a lot of myths and other things that exist. But in your opinion, what do you believe schools and communities can do together to support kids being safe medically and I guess and physically in this season?
Oh, that's a great question. I think that the best way that we can help our children be safe, outside of telling them, we always tell our kids, put your mask on, wash your hands, don't do this, don't do that, don't do this. I don't know about many parents and other children, but my kids hear what I say, but most importantly, they watch what I do. So
Oh,
if
yeah.
I'm not doing what I'm telling them to do, then they're not going to pick it up. So
Right.
when we're not feeling good, we need to put our mask on. When we come home from work, we need to take our clothes off. So a lot of times people come home and they hop right into what they want to do, and they're taking all of the germs that they've gotten from outside and they're bringing them home. Let's teach our kids that when we step inside, that we are to change our clothes. Don't hop in your bed with the
Yes.
clothes that you just had in school all day on. And so a lot of that comes from them watching us, and doing what they see us do. Also, we need to make sure that we open the lines of communications. Talk to your kids about, okay, so what happened today in school? Was anybody sick? How do you feel? What's going on with you? let's have a conversation with our kids so that we open that line of communication so that our kids feel that they can come tell us things. You know what I'm saying? We might not like all the time what they say, but we need to keep those lines of communication open. That way they're coming to us to get the correct information versus going to someone else that will give them the wrong information. So as a community, as a staff, like we need to be role models for our kids.
Yeah.
Be the person that you want our kids to be, and then also open that relationship line so that the kids can talk to us. Because if you really sit down and listen, kids will tell you.
Oh yeah.
Kids will say, "Mommy, so and so was coughing in class today, and they
Oh
didn't
yeah.
have a mask on."
Mm.
Now, you understand what I'm saying? They're gonna
Right.
tell you. They're gonna talk to you. So those are the things I think that would help us prepare our kids for that season.
That's I love that, and I'm, like, thinking about my daughter yesterday. She came in, and normally she knows, "Don't lay in the bed or on the sofa with the clothes you came in with," and she had the same clothes on, and I was like like, "No." Just
Don't do
she's 11 years old, but she knows when you come in, like, take your clothes off and put them in the laundry bin or something, but don't come on the sofa or on your bed with that on. So I love that you're saying that, and I think also we have to show that. So we're telling our kids to do that. We have to be first the ones that are role models of that. So thank you for that. Do you wanna add anything in?
Yes,
Sophie?
what I wanted to add was we should also, as a community, we should teach our kids to care about each other.
I love
Sometimes we think in a selfish kind of way, like, okay, if I'm not sick, I don't care if I'm sick and I feel like I could do things, you don't protect yourself.
yeah.
So, teach our children, like, if you're sick, it's not just about you. It's about the next person who might get sick and take it home to grandma. Like, explain to them that it's not just about you, that one person, but it's how you can affect everybody in your whole community. So we have to teach each other to care about each other. That's what we should do as a community. And by caring about each other, when something is wrong with you as a person, you protect yourself to protect others.
I love that, Sophia, and that you speak my language when you talk about caring about each other. That's one of my love languages because I think that when we were thinking about even the spread of COVID, a lot of that came from lack of caring about your neighbor, with people that were sick and knew they had symptoms, but did not stay home, did not take the extra precautions, did not wear a mask, and so forth. Um, and so I do like second that. That if we don't teach our kids to care about each other,
Mhm.
and then taking it a step further, parents have to care about other kids that are not your children. We have seen and we work in um, a number of public schools in New York City, and we have seen kids come to school sick or parents drop their kids off sick and they know they're sick. We're
Mhm,
like, no, 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 no. You got
mhm.
to come back and get your kid because they're not just for their own safety and well being, but for everyone in a school. And that typically is exactly how it happens.
Exactly.
Exactly.
Yeah.
Exactly, 100%. That's how it happens. And then we want to protect our students, and not just our students, but our students also leave school and they go home to other people. When we protect our students, we protect the people that they go home to as well, and then we can stop the spread.
Absolutely, yeah, and that actually leads right into this question, starting with Sophia is it's back to school season, and so I think in New York City, we kids went back to school about 3 weeks ago, and, um, it's insane. I've seen kids sick by the second day, and I'm like, "What in the world is going on?" So, it's also been a surge in COVID-related hospitalizations in New York City, and apparently there's another variant that's been identified. In your opinion, your professional opinion, what are the best ways to prepare our families and our kids for a healthy school year so that we're not seeing this surge again this year in COVID related hospitalizations?
That's an awesome question. I think we could start off simple by just like sticking to the basics,
Mhm.
teaching our kids to wash their hands, use a sanitizer, and one of the things that we fall short of using is masks again, because
Yes.
we think that that was only back then. And
Mm.
take it back to when we were in the pandemic, when we were going outside. If you were sick, you had your mask on, and we should teach our kids the same rules apply now. If you even have like a sniffle or a cold, you don't know what it is, wear a mask,
Right.
just to protect others until you do know.
Mhm.
Another thing is that if you're, as a parent, are at home and you're not well, have your kids wear a mask as well. We
Yeah.
have to be proactive. We have to, you know, think what can happen next and protect not just, you know, ourselves, but the kids need to learn how to protect themselves from everyone else around. So that's one of the things that we could do to help to stop this, help to stop the spread.
Thank you. And I really second those face masks because a lot of the times kids, their nose are dripping and they're touching everything. I remember every time I visited one of our programs in Brooklyn, kids would I would always I remember getting really, really sick, and I believe it ended up being COVID, but it happened so fast. I was there one day, there was like the I can't remember what reporter was covering a story on the program, and I was there engaging with kids, and of course, they wanna touch you and they wanna hug
Yeah.
you, but they're touching their nose and all this, and by the end of the day, I was high fevers at like 102, sick and could not move. It happened so fast. So you were absolutely right. Wearing those masks all over again is extremely important. And even though it's not mandated, it is highly recommended.
And one of the things that people don't realize is a lot of people have COVID and they have zero symptoms, you
Wow.
know. So, you know, where people walking around saying, well, I feel fine, so it's okay. Some people find out they have COVID by accident or they test just because they've been around someone. So you could be going by people and you have no idea because they don't even know themselves. By the time they figure out that they have COVID, guess what? You're already exposed. So just take that extra precaution. You know, if you're going to crowded places you're not familiar with, even the subway, you know, just put the mask on, easy peasy. And when you take your mask off, throw it in the garbage. Don't put it in your pocketbooks because you done contaminated everything in your pocket. But
Oh,
once you get out the tray, just drop it in the trash and make your way home.
that was a good one. Thank you for that. And how many times should we be changing our mask, wearing new masks? What's the recommendations on that?
It depends on the environment that you're in. So, say for example, you're going to work. If you leave out the house and you have your mask on, you have it on the whole ride to work. That mask, once you get into your safe environment, that mask should go in the garbage.
Wow.
Okay. Once the mask comes off your face, once you get to a safe environment, that mask should go in the garbage. People take their mask off and they put it on your desk face down. So remember when you wear your mask like this, the face
Right.
of the mask is collecting everything that you're protecting yourself from.
Right.
So when you take that mask off, you put it on your desk, you just put everything that you were trying to avoid on
Right
your
there.
right. So take your mask off every time you get to, well, discard your mask every time you get to a safe area and use a new one.
Wow. And are there specific mask types that you recommend that we wear?
Um, if for the general public, just any simple, you know, it's like a three-ply mask. If you want to get fancy, you could go for four. Um, but if you're in the health field, then it gets a little bit, you know, more technical. Also, if you are able to afford it and you know that you are sick, an N95 is always recommended because that mask contains more of the viruses than the regular three-ply mask. So if you are sick, you're going back to work or school after you've been sick, you know, during those first 10 or 12 days, you know, wear an N95 and protect the people around you.
Excellent. I'm learning so much. So the take the mask off, y'all. After you got safely to your destination, you've gotta throw it in the garbage. You cannot keep it. Don't put it in your pocket. Do not put it on your desk. Throw it in the garbage. I hope my dad
Absolutely.
did this too.
Absolutely.
That's so good. No, I this is really good information, and sometimes it really is lack of people just don't know, and that's why when you give this information now, we know better, we can do better to protect ourselves and those around us. Did Cassandra, did you want to jump in and add to that?
No, I think she said it all. She did really good. I'm over here cheering her on like she got it all.
I love it.
She did
I
really good on that one.
good, right? Yeah. See, she's like affirming you. You see that? Modeling. We're modeling how and how our kids should be affirming each other. I love it.
Absolutely.
So, in light of that, am really intrigued by your stories. LuxMed is your urgent care practice, correct? And
Absolutely.
I want to get all into it. I want to learn, how did you start? What's the mission? What is it about? What inspired you to start? And I know that's a mouthful, but not every day do we see two beautiful, amazing Black women starting an urgent care practice or running an urgent care practice. So I really want to learn and want the audience to learn the brains and the personality behind this urgent practice, if you don't mind sharing that. And either one of you can get started.
Absolutely. I'll start. It's really crazy how it started. And I kind of believe that this was something that was in the plan for our lives from when we were younger and we just never
Wow.
knew. So each of us individually have had the desire to care and to enter the health field. And as we grew older, I settled into the administrative side and Sophia settled into the clinical side. And in my heart, I've always wanted to do it. And it was because, like, I have children, I have two children, and Sophia has two children. And
Wow.
we take our, and we take, I'm drive to take my children elsewhere because I was not happy with the care that my kids were getting here in the Bronx.
Oh,
So
yeah.
I'm looking at Sophia and she's
Wow.
looking at me and I'm like, well, what about people who don't have cars to get to
Right.
different places?
That's
Where do those people go in our community that
Yeah.
can get amazing health care, that can get care from a center that they don't feel like I have to step out of character constantly every time I go to the healthcare because I'm not getting what my child needs to get.
Oh, yeah.
So I was driving one day and I called Sophia and I'm like, hey, let's open up an urgent care. And she's like, okay.
Crazy.
What do you mean?
What I said.
But let me tell you, Sophia has everything clinically that I needed,
Yeah.
that I was missing in order for us to do this thing together. And LuxMed Urgent Care is here because we want to provide amazing, complete care to our patients.
Yes.
Our patients come to us, they are not numbers, they are not just patients. They
Yeah.
are our families once they come into this place.
I
And
love
that is the setting that we have placed here because our patients are important. Do you know how many patients sit at home because they don't want to go to the doctor, still not feeling well?
Yeah.
And just because they don't want to go to the doctor, they sit at home sick. I don't want our patients in our communities sitting at home sick when we have care that our patients can get to get better. So that is the general mission of LuxMed, is to provide that amazing complete care.
Wow.
I personally go out into the community and I find out gynecologists, I find primary care physicians,
Yeah.
I find pediatricians, I find physical therapists and different specialties. And I tell you why, because we're in urgent care, so we can take care of you right now.
Right.
But I need to know that when I send you to this pediatrician, you're
Yeah.
going to get the same care that we're giving. So I don't, if I go to an office and they're not Lux, I can't refer there because
Yeah.
I need to send our community to places to where you are now comfortable to continue to feel better.
Wow.
So that is another reason and another part of what LuxMed does. Excuse me.
Mm.
It offers complete care to our patients that are not getting it. So LuxMed is here for that purpose. We're
Yes.
here for our patients, and we want to give our patients that complete care. And that was something that Sophia and I wanted, right? So it took us a minute to get it together because
Right.
we are very particular, down to our staff that we hire.
Yes.
Down to my staff that I hire. So, you know, and I tell my staff every day, I guarantee you, nobody wakes up in the morning and is like, oh my God, I can't wait to go to urgent care. Like, it's my favorite place in the whole wide world to go. Like, nobody
Right.
wakes up like that. So
Yeah.
when patients come in, I need to change that around so that when they're home and they're not feeling good, they like, you know what? I'm going to Lux because I know Lux is going to take care of me. When I get to Lux, nobody's going to look at me like, what am I doing here? Or why am I here? I'm going to get that welcoming person at the front desk. My
Yeah.
MA is going to be welcoming. My provider is going to be welcoming. And it'll be okay for them to come. So LuxMed also has a portion for our kids. So we do teddy bear clinics where we go to
I
schools.
love that. Are we gonna get some teddy bear clinics with iRays?
Yes,
Bring we want some teddy bear clinics in our school. All right, we'll talk offline. Go ahead. I'm sorry.
Absolutely. So our teddy bear clinics, we go inside the schools, and usually up until second grade, our kids can come in with their teddy bears. And literally, I teach our kids about calling 911. I teach
Yeah,
our kids about how important it is to eat vegetables and to drink water. And I teach
yes,
our kids that it is important to wear your seatbelt. There's different things that we teach the kids. In the meantime, we also teach the kids how to take care of their teddy bears' boo-boos. So
oh,
it
that's so
also
sweet.
allows, it is, right? It's so awesome. It's one of my favorite things I love to do. I sit down Indian style in the middle of all the kids, and I
I
love to talk
love
to them.
that.
I love to hear the stories they tell me about how their teddy bears were jumping on the bed and the different things that their teddy bears are doing. So amazing. I love to hear it. It's like
Wow,
a highlight.
it's
It is like
incredible.
the highlight of my day. So I love that part. And then the part that comes as a plus is that now I can tell my kids, like, when I leave your school, if you're not feeling good, if you're not feeling well, if your head hurts, if your stomach hurts, don't be afraid to tell mom and dad, because you're afraid that mom and dad is going to take you to the hospital or take you to the doctor and you're going to get a shot. If you're not feeling well, tell your mom and dad, take me to see Cassandra, because Cassandra's going to help me feel better. And now we have that relationship. It opens the doors for the parents and the kids. Now my kid is no longer afraid to tell me that they're not feeling well, because I have somewhere where I can take them to get better. And guess what? My kids are not scared, because that crazy lady Cassandra sat down Indian style in the middle of my classroom, and she talked to me, and I'm okay. And I know that if I'm not feeling good, that they're going to do the best they can to get me to feel better.
Wow, no, this is incredible. And then Sophia, I know you're gonna respond in just a moment, but I gotta piggyback off of some of the notes that I took because I was like, this is extremely groundbreaking. And I always think about things from like a historical perspective, especially when it comes to people of color, Black people. Because the reality is we have endured so much trauma in the area of medical, in the medical industry, and from experimentation to just not being treated right when we go to the hospital, to urgent care, wherever it may be. And these are legitimate fears and concerns and reasons why a lot of Black people may not seek care, that we tend to act like it doesn't exist. During COVID, we ran a number of COVID-19 initiatives, and a lot of it was based on the fear and the mistrust of people of color and the medical system, and how it's very legitimate, although we don't always want to acknowledge it as a government or society. It doesn't mean that it doesn't exist. And I think what you're doing here is you're doing something that's transcending our generation. You are dealing with what has not been dealt with for generations. You are dealing with the distrust. You're dealing with the fears that people have, and what's keeping people from being healthy. It really, and that's not everyone's story, but I can tell you that is a majority. And the Bronx has been 62, the lowest in terms of health outcomes out of the entire state. And it's been like this for I don't even know how many years. So what you're doing is you're creating a model for other places to follow. And so when I hear this, I'm just so excited. And then you're closing the gap, you're completing the circle, and that's where you kept highlighting the comprehensive care, because you're not just seeing them and throwing them off, but you're saying, well, what happens after they leave our office? I care about them. I care about their health. It matters to me. They're not just a number. They really are family. And that right there is it's the best I've ever heard. So congrats what you ladies are doing. And then I'd love for Sophia to jump in on this as well.
All right. Well, one of the things, like Cassandra said, I looked at her like she had four heads when she said, "Let's go open that." Thought she was having one of her moments again, but I let it slide. But the more I thought about it, I said, you know what? I never wanted to do anything like that because I never had that administrative side. Because you can't just run all clinical. You also need a solid backend administratively. And we had worked together before, and I saw what she did, and I loved it. So I'm like, you know what? I think we could do this.
Yeah.
So here we go. But just to kind of round off some of what she said, Me working in the emergency room, I see people come in and people wait hours and hours and hours, and especially here in the Bronx. And you guys know that if you
Oh,
go
yeah.
to any of the emergency rooms and you're not having a heart attack or you're not,
Right.
blue, you're going to be out there for 4, 5, 6, 7, 8 hours.
Oh, yeah.
My light went on, and like this is stuff that like really breaks my heart because my goddaughter, when she was little, she had a sore throat, and her mom took her to the ER that night, probably about 8 o'clock, because that's she got in and settled, and that's when she took her.
Right.
She took her with her blanket, and they got home 9 o'clock the next morning.
Oh, my Lord.
Now my goddaughter couldn't go to school, her mom couldn't go to work, and all she needed was just a test and some fever medication.
Wow.
12 hours. And that means my goddaughter sat in an emergency room with people who are really sick for 12 hours. So now you expose the stuff she was exposed to before
Right.
just for some pain medication.
Right.
So what a lot of our people don't realize that they have is access to quick care, which is urgent care, which they don't utilize. And again, some of that comes from the mistrust that they've had in the past, because I can't tell you how many people say, oh my God, I'm not going back to that urgent care because they don't know what they're doing. And, we want to break that, not here at Lux. When you come here, the goal of us being here is so that you don't have to go to the emergency room to expose your family to God knows what there, but come in short, you come in, it's a short visit and you get to go on with your life. You get to make it to
Right.
bed, you get to go to work. So
Yeah.
that's one of the big reasons. Everything is so clustered that I've seen people discharged from hospitals. They don't even know why they were there. They don't even know what medicine. They don't even know where to go next. And they come again, and I don't know what to do.
Yeah.
So by us being here, we're able to sit with patients, explain to them, speak with them, and guide them the right way that they should go, because we're not your typical place. We
Yeah.
take the time to understand you, your family, and provide or direct you to the best place for you to go. We have to be aware that these places exist. People are
Yeah.
still running to the emergency rooms for quick things. They have a cough, they have a runny nose. Utilize what you have so that things go quicker and you get back to your life. The other thing, like what Cassandra said, she's our mayor. She goes out in the
I
community. She knows everybody. I don't go anywhere with
love it.
her because she can't walk down the street. Like, hi, Cassandra. You know them too.
No, everybody. Yes, I love it. I love that.
But the goal is to actually build our community. This is our community, and we're
Yeah.
specifically here because we don't just work here, we live here. And we want to utilize the other facilities that are in the area as well. The doctor that's 2 blocks over. Now my patient doesn't have to drive or be on the bus for 45 minutes just to go somewhere. They could use all local businesses, other local practices, and we all work together to build our community to make it healthier.
Wow.
So by networking with each other, we can form like just a big team and take care of our own community and make it stronger.
Yeah, a network of care.
Mm-hmm.
It reminds me of this show. This may sound so funny, but I think it was called Heart of Dixie or Heart Dixie, one of those.
Remember that show?
I
Yes,
think
but she was like coming from this big city, and
Mhm.
I think she was a doctor, a physician
Mhm.
coming from this huge city, and it took a job in a small community, but it was a family practice.
Mhm.
Everyone knew everyone, and that's important too, to providing holistic care. If you don't know your patients, how
Mhm.
could you really provide the care that they need?
that's right.
Some things might actually be connected to mental health, and we've
Mhm.
seen that, 'cause there are some mental health disorders where there are physical, symptoms that people may feel, like anxiety,
Mhm.
like panic attacks. Those manifest itself, a lot of times through
Yeah.
physical symptoms like can't breathe, chest tightening, heart beating really fast, headaches. All that is a lot of it is connected to anxiety, and not all the time, but anxiety symptoms or patients dealing with some form of panic. And we see that a lot. So even understanding your clients, are there other issues outside of medical
Yes.
you need
Mhm.
to know about in order to really support them?
Absolutely. Absolutely. I think one of the things I love most about my providers is that they listen. A lot of patients go to different doctor's office, and if you just listen to your patient, you can get information that you need to help care from them. And when my providers listen, and sometimes I have to knock on the door, like, come on, but they're listening. And I'm okay with that because they're listening and they hear my patients, and that's so important.
Yeah. That's so powerful, Cassandra, listening to your patients. I seen, and I'm gonna use another example. This is a show though, but and I can't remember if it was all about the Washingtons, but I think it was that show.
Mm-hmm.
They have mixed it up, but it's Tia.
Tia and Tamara, sister, sister.
Yeah, but she's older now and she has her
Oh,
own
okay.
family. So anyway, she's pregnant and she's given birth, and I think she ends up having a C-section. But she's telling a doctor something's not right. And the doctor is like, "You're fine." Actually the nurse is telling her, "You're fine. There's nothing wrong with you." She's like, "No, something isn't right." And they didn't listen to her, but thankfully she had like a strong black, mom there
Uh-huh.
advocating for her, was like, "You gonna listen to my baby."
That's right.
And so come to find out, I can't remember what it was. It was a really serious condition that could have killed her. But thankfully, she had an advocate in the room with her,
Mm-hmm.
and she was able to get the care she needed. And I think the episode was so real because it was in dedication to Black women that
Mm-hmm.
are dying at high numbers when giving birth. But I think a lot of times what you said, Cassandra, is so powerful that they're not being listened to. A lot of patients are just not being listened to. They're being ignored.
Yeah.
Mm-hmm.
That
And
just breaks my heart what you just said. I'm literally like, I didn't watch the show, but what you're saying is reenacting, and I'm like, that's the thing. Nobody's listening to people, and people
Wow.
think that things are so complicated. Just have people speak, and when they speak to you, the answer is right there, and it's not hard.
mm-hmm.
Yeah.
So just take a moment. I love to listen to my patients, and
Wow.
like right now I'm like trying to cheer myself up because I'm literally picturing this black woman giving birth and saying something is all right, and you're telling them you're fine. How do you do that?
Yeah.
Right.
It's so
Right.
true.
Yeah, that is heartbreaking. It happens every day,
Yeah.
so often, and it's we have to break that chain.
Wow. Yeah. That's like a moment of like silence, like
Yeah,
just
yeah,
Absolutely.
take
yeah.
it all in. We were talking before we came live that the statistics show that um, Black people or people of color who receive care from doctors and medical professionals of color actually have better outcomes. I'm wondering if you can give us your theory, your professional expertise and theory on why you believe that happens.
Uh, what I think it comes down to, like, they think they can relate to you more. Like, you
Yeah.
understand where I'm coming from. Let me talk to the Bronx. You understand what my mama would say. You understand what happens at my house. You understand grandma mix some stuff up. You understand they take the Vicks and they rub it at the bottom of your feet. You know, you know, you know? Sometimes this goes cultural. My family's island, and
Yeah.
we're such a rich rich culture from
Yeah.
different countries and islands that we have to understand where people come from, because
Right.
by doing that you're able to care for the person within their own culture,
Yeah.
and people trust you more when they think you can relate to them, when
Right.
they think that you understand. You're not just like, okay, well, the book says this, so it must be that. No, no, no. When she goes home, she's not going to do that because her mama's not going to give this to her. You know what I mean? Kind of like
Yeah.
that. And you have to understand that kind of dynamic to be able to tailor care for your patient. And
Wow.
by being able to show that relatability, if that's a word,
Yes.
people are often more likely to be compliant. So that I could definitely, that I would say would be my theories. The fact that you understand where I'm coming from, right?
Right. Right. Right.
Disclosure.
That's
You
Right.
know,
right.
I love that. It reminds me of a story, and I'm so sorry, I'm a storyteller,
No, it's okay.
where my daughter, one day I was, working and something said, "Go check on Genesis." But I didn't, and I was like, "She'll be okay. I'll check on her like in 5 minutes." She comes downstairs screaming with blood everywhere. I'm like, literally, I almost passed out.
Oh no.
I was like, "Oh my god." I think so I was, like, operating now or fight, flight, or freeze. So I immediately was like, "Oh, it was from her hand." So I was like, "Put it under the water and let's see." But clearly she needed stitches. So we ran out of the house within, like, 2 seconds. Now, I'm actually in Atlanta now, so there are no hospitals nearby. So we had to drive, like, 20 minutes. I must have broke the speed limit, ran through some red lights, and I don't regret it. Got to the hospital, and what's so crazy, so she needed to get, I can't remember how many stitches, but quite a number.
Mhm.
And when we got there, she was really just anxious, and it was so hard to calm her down. And they were like, "We're gonna give her this medicine, some to sedate her." And I was like, "Absolutely not." And they're like, "We're gonna have to do this to calm her down." I'm like, "She's a 9-year-old, 9 year
Exactly.
remember how old my child was, and you're not giving my child this." And it took a Black doctor who came in with her bonnet, I must say. She had her bonnet on,
Mhm.
and she came relatable and was like, "Listen, baby girl," and stood right at the
That's
bed,
right.
Good.
and
That's
she
good.
talked her down, and my child didn't need no medicine. And she talked to her the entire time she stitched her, and I tell you, I have never received that level of care before.
Mhm.
We felt so good. Thankfully, I didn't pass out because they would have need to pull the
Gurney for
cord,
you.
or I needed to be right there. So thankfully, it prevented me from passing out too. And then she just treated us with so much care and respect, and she related to us, and
Mhm.
that is something I would never forget.
Mhm.
Absolutely. And that goes to show why it is so important that they visit places that they connect with.
Yeah,
Because no, I'm not just going to pump your kid full of medicine because it makes my job easier. I'm
Mhm.
not.
right.
I'll make everybody step away and I'm going to give your kid a moment. Children should be allowed to be afraid because look at what's happening. You have to meet them where they are. So
Yeah,
yes, we know you are afraid, but guess what? We're here and we're going to get through this together.
That's right.
yeah.
That's what our kids need to understand. Not just be
Wow.
like, oh, well, you can't be afraid. No, baby, you have every right to be
Yeah,
afraid. Like, we got all kinds of needles and stuff coming at you. So, do you have a right to do that? Yes.
yeah,
But in the same token, you're not afraid and you're not in this
Mhm.
by yourself. You have
mhm.
all of us here, and we are here to support you. And at every moment, we are going to get you through to the end.
Wait, Shanika, you should, you
Wow.
should, you should, you should see her. Like if I'm in a room, right? And for example, I'm giving like shots or vaccines, and the kid is, you're like, I go, Cassandra, come here. She go, come here, baby,
Come here,
come
baby.
here,
We
come here,
got
baby.
this.
Oh,
And she just wraps them in her arms, and she's here. It's
oh,
all right, baby. It's all right. And she literally has them
that's so
like patted.
sweet.
Mind you, I'm on the other side giving a shot.
Yeah, and they have no idea, and it goes by so
Yes.
wait, I have one question, Cassandra. When I get my needle, can you hold me too?
Yes, girl, I got you. You just video me and we're going to get through it together, girl. No worries. But it's so
I hate needles, but
important
It's important.
because the kids
They're
need it
afraid.
and we can't tell our kids
yes,
that they can't feel.
But you know what
right,
though? Parents are afraid too.
They are.
Yeah.
right.
They
I
are.
am,
And I have some
absolutely.
parents that come like, look, Cassandra, they get ready to get my kid. You got to go in because I'm coming out.
Right.
And I'm
Yeah.
like, okay, like,
Yeah.
come on, we're here to support each other. And our kids need
Wow.
support just as much as my adults do, too.
Yeah.
So,
Yeah,
and that teaches them to learn that, okay, look, I'm not going to be able to like everything that happens, but
right.
guess what? With my support team, I can get through it.
Yeah.
I
Wow.
have talked so many kids through shots. I've talked them through getting
Stitches.
sutures, all kinds of
Wow.
stuff, and it's not easy.
Yeah.
It's not easy because we do have
Wow.
to give them needles and stuff,
But that's where
but
the
they get through
yeah,
it.
and that's where patience comes in. Everybody's
Incredible.
always in such a rush. Like I stitch kids all the time, and I sit down there and I'm like, listen, are you gonna trust me? Yes. Is it gonna hurt? People go, oh no, it's not gonna. I go, no, baby, it's gonna hurt. But you're gonna count to 10, and by the time you count to 10, it's over, and that's the
Mhm.
only hurt you
Wow.
feel. And that's how I talk to my kids from 3 all the way up, and we sit there, and I said, you trust me? And they go, yes. And I said, I'm gonna tell you what's gonna happen. And
Yeah.
literally, we
Mhm.
get right through it. They go 1, 2, 3. I'm usually done by 8. And it's such a big difference. And even the parents, everybody just stays calm, and it
Mhm.
becomes a better experience just in general in preparation for another time when we may have an incident.
Wow. How do you take this model and replicate it to other practices? I'm like, you gotta create a training or coaching program for other practices so that they can adopt this model.
That's the goal.
That's the goal.
We want people to see what we do and say, look, we got to be like Lux.
Yeah.
So
Yeah.
the goal is that we take Lux Med and it trickles to other practices. And when we look at it over a period of time, we are going to
Raise the
change
standards.
healthcare in the Bronx. And we're going to make everybody
Yes.
up to where we are because that's what our patients need.
Yeah.
That is actually the goal.
And it becomes what they expect. They don't just settle for anything, but you know, you come in and you expect a certain level of care because you can't expect what you don't know. If you're not used to a certain thing, you won't even know if something isn't being done right if it's never been done right before.
Wow. Mm-mm-mm. We're gonna raise up the health outcomes of
Yes.
Bronx folk. We're not gonna stay number 62.
No.
Absolutely not.
We cannot anymore. And actually, there I don't remember who the agency is that spearheads these research, but they have all these. I can't remember. I'm sorry, but it is a research-based entity that goes around and they sort of survey the different areas and neighborhoods and council districts of New York City, and it is it's actually a known fact that if you live in the Bronx, your life expectancy is actually much lower than if you live in Manhattan and other more affluent places.
Oh wow.
It's true. It's true.
And that's sad. It shouldn't be like that.
Yeah.
We gotta change it.
You gotta change
Gotta
that.
change it.
That's it. That's
Absolutely.
it. We gotta change it. It has to change.
It's incredible. How do we create pathways for kids of color to join these types of careers early on, or at least pique their interest that this is possible? Because I think the other part that we haven't really spoken about is the lack of representation of Black doctors, Black medical professionals, especially women. Now that the number trickles down to smaller. We're talking about Black women. It's like it's a scarcity, right? Like, how do we create pathways to get our kids of color intrigued and interested in this type of work early on?
Do you want my from the heart answer?
Yes, give it to me. Give it to me raw. Yes.
Please just come see me. I want to help everybody. Let me tell you, I would love for us to just, if they have any questions, if they want to join the healthcare field, if there's anything that I can do to help them, if their parents are at home and they're watching and they're like, oh, my child wants to do A, B, and C. If you want to give your child my number and tell them to call me, I'm all with it.
I love it.
I would love to have a place where the children can come and they can see and they can say, oh, look, I want to do this, or look, I want to do clinical, then I'll give them to Sophia. And if they want to do administrative, then I can keep them for myself. But
I love it.
In my heart, Shaniqua, I'm telling you, I would love for them to just come see me.
Yeah.
Come see me and just let's do it. Let's go. Let's go. Let's move forward. We can talk about schooling, where you want to go to school. We can talk about the person.
They have the whole Bronx outside.
We can. We can. But
Look, still welcome them too, Sophia. I'm like, wait, guys, give me a minute. I'll be back.
Let me tell you, we can talk about the kind of personality you need. We can talk about the kind of education. And yes, you're going to school now, but you have to prepare for your future now. So yes, I know you may not enjoy math class and you may not enjoy reading class, but guess what? I need you to push past that, and I need you to make those A's, and I need you to make those good grades. But most importantly, I need you to give your best. Yes. If that's your best, and whatever your best may be, I don't want you to be afraid about what your best is. Because if you have in your heart as a kid, or as if mom or dad says, look, this is what my child wants to do, listen, we're going to do it together, and we're going to be great. We're going to get you into schools that you want to go to. We're going to set the foundation that you want. So my heart answer is just tell them to come see me. That's my heart answer.
And then the practical answer comes.
The practical.
She'll give you the practical answer.
I love it.
My answer is I just want to help. Let me tell you, if I could, I would help everybody. That is what I would love to do.
Yeah.
But in all actuality, if they come, I'm helping. I don't care what nobody say. I'm gonna help. If it takes a little extra time, I'm okay with that. Do
I
you
love
know, like, if I when I was younger, I wish I had someone that would come give me that time, that base.
it. Yeah.
It's all in your personality. Kids don't, they feel like school is a chore. You understand what I'm saying?
Yeah.
But when you now set your kids, say, listen, this class, you may not enjoy it right now, but it's going to help you in your future. Let's
Right.
focus. And you're going to give your best in this class, and you're going to get those grades, and you're going to move on, and you're going to get past that class to go to your future that you want. So, and they have to take things that they experience in life and help build the character that they need in order to get in this profession, into this healthcare, so that they can have the heart that they need to have in order to be in this setting. So it
Wow.
starts at when they're kids. It starts now.
Yeah.
So
You gotta
Wow.
expose the kids. You gotta, if you like, it goes back to, again, you can't expect what you don't know. You
Yeah.
can't aim for what you can't see.
Yeah.
When I was in college, I was pre-med. I wanted to be a doctor, actually, and I had no ideas what PAs were, no clue. And there was actually a school in the college I went to, and I had no clue. I didn't even know what PAs were. I was never exposed to it. It's always, oh, this, and I had no idea. And it was not until after I graduated from school, from college, and I was like, I'm getting ready to do my MCATs. And then I said, there must be something else. Let me just look out a little bit. And I found these people called PAs. I'm like, who they? And then when I looked into it, for me, it gave me the same satisfaction to care for people, but I was never exposed. Now, I could have been finished like 3 years earlier, but I couldn't do what I didn't know. So one
Wow.
of the things we could do as parents too is that we have to expose our children to what's out there. We're in such a little box, and I'm going to use the Bronx as an example, the Bronx of the box, that you're only used to what you see around you. You got to step out of the box and see what else is
Step out
there.
the box. Yeah.
Yeah, what are other people doing? What are other people experiencing? Because you got to expect more for yourself, and we can't tell people or our children that they can't.
Yeah.
What you want to do, baby? Yes, you can.
That's right.
You're going to rule the country? Yes, you
That's
can.
right. Yeah.
We have to plant seeds of positivity in our children, because things that we say to our children, even casually, those are things that get planted in them. Yes, you want to move the world? You can. You're going to change the world? Yes, baby, you will. And
That's
you support that, and you push that. Even sometimes if you yourself don't believe it, you got to believe for them. but you but
right.
you have to give that support. And I wish, growing up, I was exposed more to stuff that we're doing. I didn't have that. And I wish, like, my son and my daughter, being able to expose them to this at an early age, for me, is providing like a legacy, or having them see that I don't have to settle. There's more out there. And I just wish our parents would take their kids and just have them see more. Have them see more. Look it up. Put them in it. Have them do volunteer at the hospital. Let them go into STEM programs. Let them go into whatever it is there is. Let them go into it, so they can feel and they could understand. And for my older parents, or my older kids, we got to learn how to represent ourselves. We got to learn how to put ourselves together when we walk into a room, that they don't just look and be like, oh. No, we got to look at ourselves, so when we walk into a room, we command what we want. We
Yeah.
don't just show up. We've had people show up in sweatpants and t-shirt for an interview.
Oh no.
Yes, but if you're
they do.
Oh,
I send them back home. You come to an interview with me with sweatpants on, I'm gonna be like, honey, you was not ready today. We're gonna go back home, and we're gonna try this again the next time. But it's true. We
but this
need
is
our
what
students.
right, but this is what they see.
Mm-hmm.
And unless they have models around them and say, okay, this is how you put yourself together to go to work. This is how they need to see that. But we have to get ourselves out of that box and expose our children to what's outside of the box, that where the rest of the world actually is.
Wow. This is so good. I wrote some things down. Exposure was the theme um to creating these pathways. So we have a program that's called Generation Z. It was birthed during the pandemic, and the program is geared towards creating these career pathways for kids of color to launch into certain careers early on, through exposure, and to allow them to have access to industry-based knowledge, so that hopefully it'll fuel their passion for that specific career, and they'll be able to pursue it later on in life through college or other training programs. And so one of the fields is medicine. And we're running this program actually right now in the South Bronx. So it's running out of my old high school, Health Opportunities. And this particular program, so we run it for entrepreneurship. So kids that are interested in running their own businesses. And then there's mental health, kids interested in being mental health professionals. And then it's medicine, kids interested in pursuing medicine. But what I'm thinking of, and it's broadening in my mind talking to you two ladies, is we need to create more pathways within medicine, like physician assistant. There's so many other avenues to pursue, but if kids don't know, like you said, you would have been done 3 years earlier. If they have this knowledge accessible, then we can actually change a trend that
Yes.
where there's not a lot of women of color in medicine. If they know it doesn't take, you don't have to necessarily be a physician if that's not, there are other ways that you can
That's
pursue and still reach that and feel that sense of satisfaction and purpose.
Absolutely.
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 So then,
Definitely.
I gotta ask you ladies if you could be some mentors to these kids.
Yeah, you know I'm down. I'm ready. I'm so ready.
She was born ready.
You don't have to ask me twice.
I love it. I love it. We have to bring you to this school. It's right off of Grand Concourse and 149th Street. So we'll definitely arrange that, especially probably during career day. That typically happens in the spring, so we have time. But no, I love this. This is incredible. So we're almost wrapping up here. We have just a few moments. We appreciate all of you for staying tuned, staying connected to us during this conversation. If you have questions during a time of the chat, feel free to put it into the chat box or comment. And if you're watching this afterwards and you have questions, we still want to hear them. We still want to hear your comments. We will do our best to get back to you and respond to it as well. So we talked about so much. We talked about representation. We talked about remaining safe during COVID. We talked about pursuing career pathways and STEM. Is there any advice that you ladies would provide to young people that want to get, and Cassandra, I feel like you've already started providing that advice, but any advice that you would share with our youth that may be interested in healthcare, or interested in pursuing some type of role or status within the medicine industry? What advice would you give to them?
I think it's usual that people say, never give up, right?
Right.
But when you're picking a field in healthcare, it's okay if you hit a corner and you're like, you know what? I don't want to do this. But
Yeah.
just because you hit that corner doesn't mean that the whole field is not for you. So I want our students and our young people to be persistent. Be persistent about what you want. And if you don't get it the first time, it's okay. Just don't give up. A lot of times, especially for minorities, society makes it so that you may want to give up.
Oh, yeah.
That's the way it's set up to do. But I want them to know that you can do it and you do not have to give up. You can keep fighting. You are there. There's people like Shaniqua and myself and Sophia here to support you so that you don't have to do it that way. So I want them to just keep going. Be persistent. That's what I want them to do.
That's incredible. And I think that's great. I'm going to share a story after you, Sophia, about a person that didn't give up and a counselor told her just that. I'd love to hear from you, Sophia.
I say, like, just start early. From the moment, like, it's in your heart that you want to help people, that you want to go into medicine, start early. There's so many things you can do. You can expose yourself to. For example, like in my hospital, we have people called scribes or sims, where young college students come in and they scribe my notes for me. But while they're doing that, they're seated in the ER and they see everything that comes in.
Wow.
So they're getting that experience. You're seeing nurses work, you're seeing doctors work, you're seeing PAs work, and at the same time, you're getting paid. So there's so many ways. And so by starting early, I've had quite a few of those students who come in as Sims. They go, I thought that I wanted to do this, but you know what? I think I'm going to go do this instead. I don't think I can handle this.
Yeah.
Because people sometimes have in their head, well, I want to do this, but when it comes down to you can't. And like Cassandra said, not because you hit a bump, it doesn't mean that's it. It just means that you got to shift it a little bit. But you got to start early. Don't wait until you're in your 20s. Start in your teens. Find a local doctor's office. Volunteer to work in the office. Go to the hospital. Bring juices and stuff to the patients. You'd
Yeah.
be surprised how much you see and learn. And you realize if this is what you want to do. And it also builds that passion in you to do what you want to do.
Exposure.
Mhm.
It just reminded me of another something when I was when I graduated from Health Opportunities. I did an internship at a nursing home in on Allerton Avenue, and it's a health based school. But I realized this medicine is not for me. But it wasn't. I didn't stop there. It was mental health that really was my. So it's all interconnected. But I realized that that's not for me. But
Mhm.
helping people is for me in
Mhm.
another way. So to your point, Cassandra, you might hit that bump in the road where it's like, okay, maybe this is not what I'm supposed to be doing. But
Mhm.
there are so many other areas that you may not even know about that may fit what you're supposed to do. And then just what Sophia stated, there's so many other like scribers. What is that? What you call them?
Yeah, they're medical scribes.
Medical scribes. Look at that. And you're still getting exposure. There's the physician assistant that you talked about. And there's so many other avenues that you can pursue within medicine. And then lastly, I have a good friend. Her name is Whitney, and shout out to her. She's a registered nurse in multiple states, and she got pregnant, and she was a teenager. I think she was in high school, and she actually was going to pursue being a doctor, but she felt, you know what, this is not for me. I'm going to drop out because I'm pregnant and, my life is over. And a counselor talked to her and said, well, why don't you just why don't you pursue nursing?
Mhm.
Um, and she never thought about it before, but a counselor told her, don't give up, to your
Mhm.
point, Cassandra. And she did not give up. And today she's a licensed registered nurse in multiple states and doing very similar work to both of you ladies.
Look at
I'm
that.
introducing to. She is changing the game and
Right.
creating equity inside of healthcare practice, specifically for patients of color. And so I love that. It
Absolutely.
sounds very cliche, but it is very profound. It is powerful. Don't give up.
Mhm.
There is a place for you. It may not necessarily be as a doctor, maybe it is, but
Mhm.
there is a place for you. It may not be in the medical field, but whatever it is, there is a place for you in this world. Don't give up.
That's it.
Right.
That's it. That is exactly it. Just don't give up. Because, like you said,
Yeah.
it's somewhere where you deserve to be, and there's somebody that's waiting for you to get there.
Yeah.
Yeah.
So just don't give up.
I
And
love
just a little tidbit, like in our journey in creating LuxMed, oh my gosh, Shaniqua, ooh, we should have given up a long time ago.
No, I'm so glad you did it,
We should have given up a whole long time
but
ago,
you didn't.
but we kept pushing. And if someone should actually sit down and
Incredible.
even just hear the true story of what we had to go through to be at this moment, you'll
Wow.
be like, yeah, I would have done. Would have. But it's a lot. And as a person of color, and we're women as well, but even just being a person of color as well, you gotta fight, you gotta
Mhm.
push. There's so many obstacles, and you just gotta know that this is what you want, and be strong in what you're going for, and just go.
Mhm.
Just go, because there's going to be a lot of brick walls, there's going to be a lot of iron walls, there's going to be a lot of trenches, and you're going to get down and dirty, but at the
Mhm.
end, when you come out on the other side, it's so worth it.
It's
It's so
Wow.
worth it.
I
but
literally got goosebumps. You already know I'm a storyteller. I'm not gonna tell no more stories, I promise. What can I tell you? That is so real. There's so many people waiting for us, Cassandra, you said it, that are not giving up, us being in our right place. A lot of people are depending on that. People that we've never met, people we don't know, are depending on us to be in our place where we belong in the world, to fulfill our purpose so that they can get the help they need in their lives as well. But it's so profound that a lot of times getting there is not easy. The road, the journey is so difficult. But like you said, Sophia, as woman of color, you gotta fight. Like you don't have a choice. I tell my daughter every day, she's at a predominantly white school. And I'm like, look, you ain't got time to get no bees. Like you cannot. And this may sound like a lot of pressure, but don't worry, I have some other incentives I do to spoil her. But I'm like, you can't mess up. Like you cannot get less than this. We need to make sure whatever I need to do to support you, you got to get A's. Like you can't be just because you're a girl of color. And I have these conversations with her, and she's 11 now. So being a woman of color, you have to fight harder.
Mhm.
The world that we live in. No, it's not fair, it's not equitable, but it's the world we live in. It's our reality. And it's women of color like us telling other women of color, you can make it. You can get to the other side. You don't have to give up where you are, that there is still hope and you can fight through this because we did. And so I love this. It's so good. It's turned into a whole other session. But Cassandra, I can see you want to say something. Go ahead. Piggyback.
No, I just was piggybacking off of what you were saying. Like there were so many obstacles and stuff that we would hit. And sometimes people feel alone, and we need to let people know that you're not alone. Because when we was going through this whole thing and I would look like I want to give up, she'd be like, yo, you crazy, we're not giving up. And then there would be times that she would want to give up and I'd be like, yo, you crazy, we're not giving up. And it just you have to have that. So just picking back off of y'all, just off of what you and Sophia was both saying, it's super, super, super important. Don't give up. We don't give up. And if people get mad that you are where you are, that's okay.
Right. That's right.
And the other end of not giving up is us on the back end. If these are our children, it's support.
Mm-hmm.
You'll be so surprised. You don't have to have money. You don't have to have the big things, but just saying, I got you. I'll bring you some lunch. I'll bring you some food. It's okay. I'll do this. My mom, and Cassandra's mom, like they watched our kids while we're up late at night doing stuff. And it may not seem like much, but them being there to do that allowed us to do this. They weren't, complaining and like, oh, you're not home. No, they're saying to the kids, it's all right. Mommy got to work now, but it's all right. Mommy will be home later. So we could get to here. So the fight is one thing, but you got to have the support on the back end too, because it makes it even feel more so like it's worth it because you got a team behind you.
Incredible. It really is a community because we can't do any of this by ourselves. And you two were there for each other, but you had that support system, your moms that were willing to step in order for you to do what you needed to do. It is a community, it's a collective effort. So this is incredible. We got to have a part two. Closing. We're closing, and I want to know how can people, if we can get the address up there and the website of your practice, how could people reach out? When should they reach out? When should they come to your practice? What is the type of patients that you see? What type of, I guess, symptoms? And we see the address up there. Excellent. But if you can let people know that as well.
Absolutely. So our office is open 9 to 9 during the week and 9 to 7 on the weekend. And patients who are having trouble, have a cold, runny nose, we take care of lacerations, we have x-ray, we do COVID testing, we do flu testing. All of those patients can come see us. And even if you're not sure what it is that's going on, but you feel like something is wrong, my providers are emergency-based medicine trained. And if you need to go to the ER, I guarantee you will get you there. So even if you feel like, okay, look, something is not right, I'm not sure what it is, but I'm going to go and see with them and see what they say. Either they're going to help you fix it or they're going to send you where you need to go to get it done.
Amazing. Amazing. Incredible. And I actually used to live at 3628 East Chester Road. Funny, right down the block. Yeah.
Oh, wow. Yeah, we're right at the corner of AD Avenue. Like we're right like 2 blocks away from the post office on Gun Hill Road. So if you need a marker, that's kind of where we are.
So you're right on that, on the there's a nice Jamaican restaurant there. They make really good coffee too. I can't remember the name of it, right on the corner of East Chester Road.
Are you thinking about Platters?
I don't know. That's not the name of it. I can't, unless they changed the name. I can't remember.
We're in the building that used to be a famous restaurant. We're in that actual building. Yes.
That's incredible. Yes.
That
I
famous
love it.
restaurant, that's where we are. We're right on the corner, right by the triangle of Gun Hill and East Chester and 18th.
Yes,
We're,
yes.
we're in that
In
famous
that building.
restaurant building. We're in that building.
That's incredible. Okay, this is amazing. So everybody in the area, we need you to, if you, God forbid, are ever feeling any of these symptoms, please go to LuxMed Urgent Care. They're going to take care of you. They're going to treat you with love and care and respect that you deserve, and you're going to get the treatment that you need, you and your family need. That's the address there. Any last words, Sophia and Cassandra, before we close out?
Thank you. Thank you
Thank
so
you.
much, because I like to talk. So thank you for giving me this time to talk.
Thank you.
I like to encourage, and I like to help our community. And just to remember that we are here specifically for our underserved community, our community that needs us. We are here for you.
And our tag is come experience the difference.
Mhm.
So we invite everyone to come by and just experience the difference.
I love it. Come experience the difference. That is what you're going to get. And that is their website, luxmeduc.com. Please visit. And can they book their appointment online, or should they come right in?
They can book an appointment online, or they can walk in, whatever they're most comfortable with.
Awesome, awesome. See, I wish, when I was up there, I wish you guys were open. I had to go to Montefiore and tell that story. But anyway, this has been incredible. Thank you.
Yes.
Thank you so much, Cassandra. Thank you,
Thank you
Sophia.
too.
Thank you for not giving up. Thank you for fighting. Thank you for pushing through. Thank you for what you do. Thank you for finding your place and our community in this world so that others can too. We appreciate you so much. And this is not goodbye. We're going to be in touch.
Yes, absolutely. Absolutely.
Yes.
You're
Amazing.
stuck with me now, Shaniqua.
Oh, I'm stuck. I already made my I did it myself. So yeah, I love it.
She just made you a
But-
cousin.
That's it.
Yes. See, now I got somewhere to go when I come. I'm just gonna come just stop by. That's
That's it. That's it. Thank you
But
so
we
much.
appreciate
Thank you so
you.
much. It's been a
Thank
pleasure.
you. Yes, likewise. And thank you all for tuning in, to all of our followers and supporters. We appreciate you too. Do us a favor and lift this conversation up for us by liking, sharing, commenting below. Share it out to your networks, your colleagues, your patients, your families. If you're professionals, educators, social workers, business professionals, we want to get the word out. Even if you're not in the Bronx or New York City area, we think this information is important to get out to the community. We are in the business of inspiring, uplifting our communities, and we hope that that's what you got from today's conversation. Please stay tuned. Every Friday, we have new episodes for our ATL Rise podcast that's being released. Our next episodes won't be released until October the 13th. We're in the process of rebranding, but you can go ahead and listen to any of our former episodes by going to your podcast platform, whether that's Spotify, Google, or Apple, and look for Atlanta Rise. Again, we love you all so much. We appreciate you guys. Stay healthy, please. And remember, when you take that mask off, throw it in the garbage. Do not put it in, and don't put it in your pocket. Throw it away. Throw it away. We want you to be safe. We want you to be healthy this holiday season. So please
Absolutely.
stay healthy, stay safe, and please reach out to LuxMed for any questions that you might have, and follow their pages on social media. You're on social media, correct?
Yeah,
Absolutely.
Awesome.
Instagram.
And
Twitter.
No, yeah, Twitter.
Twitter, Instagram. Amazing. Thank you so much, ladies. Thank you to all of our participants and those that tuned in. Please stay tuned. We'll be back next week. Thank you all. Have a great week.
Bye.